Welcome to this short educational webcast. We've created it for your information and professional competence purposes. Although this webcast does not deal with a specific clinical scenario, the information contained should help inform your overall practice and improve your clinical effectiveness. Remember, webcasts are not intended to be full training courses. However, they are intended to improve your confidence when dealing with similar situations. Practitioners must only act in accordance with CPGs and their current scope of practice and status on the register.
Incident reporting is really important because we've two responsibilities. We have responsibilities to the individual patient to ensure that they don't come to any further harm, and we also have a responsibility to all of the patients that we see. And if we can have a culture within the National Ambulance Service where staff feel safe, that they can come forward and tell us when they've made a mistake, we can use that as a learning opportunity. We can use it to change our policies and protocols if required. We can feed it back to FEC to perhaps change CPGs, but ultimately to end up with an environment in which the chances of patients coming to harm as a result of our actions are minimised. What we want people to do is in the event of any clinical incident, that the people looking after the patient are informed that most of the time that's going to be the receiving emergency department, so that the medical and nursing staff are aware. And once that has happened, it then should go to the Education and Competency Assurance Officer within the National Ambulance Service as soon as is practicable. Obviously, if it's middle of the night on a weekend, that's not going to happen instantly, but as soon as is practical. So the Education and Competency and Assurance Officer within the National Ambulance Service are, in his or her absence, the Operations Performance Manager. We've recently issued an adverse clinical event policy within the National Ambulance Service, and that very clearly outlines the responsibilities that everybody has: staff members, managers, area medical advisors and the medical directorate. It also emphasises that we're really trying to put in place a blame-free culture. If you make a mistake and if you come forward and tell us about it, we will treat you sympathetically. That is very, very important, because otherwise the organisation misses an opportunity to learn from your mistake that others may make in the future. So that whole concept of a blame-free culture is really, really important, something that we're going to be pushing very strongly in the months and years ahead. The Education Competency Assurance Officer will meet with the relevant people involved. They'll review the incident with them, maybe access the PCR, the hospital records, perhaps listen to control recordings, and they will then bring that information to the area medical advisor and discuss it, and then some recommendations will ensue from that. We anticipate the vast majority of these will be fairly low level, where there was inconsequential harm came to a patient, and that might be resolved locally by just simply a chat with the AP or paramedic involved, or potentially a short period of refresher training, something like that. A small number of them will involve significant harm to patients. Hopefully that will be at a minimum, but we accept that that's going to happen, and anything where a patient has suffered significant harm or died gets reported to me or to the Deputy Medical Director, Mark Doyle, directly, and we will examine that. But irrespective of the outcome of the patient, I think it's important to stress, if somebody comes forward and tells us that something happened, we will look on that very sympathetically and treat people accordingly. Equally, if people don't come forward and try and conceal it, we will take a very negative view of that, and again treat people accordingly. So the message, I think, is clear. If you make a mistake, that can happen to anyone. To err is human. If you do it, tell us and we'll deal with it. So if a practitioner witnesses another staff member making a mistake, I think it's important that they firstly ensure that no ongoing harm comes to the patient. So they should, in a diplomatic manner, make the other staff member aware that maybe they shouldn't give that drug or consider an alternative course of action, and ensure that the patient doesn't come to any harm. And then one would hope that the person who has made the mistake or was about to make the mistake would come forward themselves. That's what we want people to do. However, if they don't, if they don't do that, I think it's important that the person who has witnessed it should make it known to the relevant people, because again, there's an issue here around the individual patient, but there's also an issue for the organisation, where we would use this as a learning opportunity to learn from that incident and ensure that other practitioners don't end up making the same mistake. I think every near miss needs to be reported. If an event occurs where potentially a patient might come to harm, we need to know about it. If we don't know about it, we can't fix it. And we want to try and provide the safest possible level of pre-hospital care for patients that we possibly can. And we can only do that if we know what the issues are around the country in the back of ambulances, on calls. So we need to know about it, and if we know about it, we can fix it. The culture in healthcare organisations traditionally has not been good in terms of error reporting, and that's understandable. If people make mistakes, they feel threatened, they feel it might affect them within the job, and they don't report it. That is true for the ambulance service. It is true for other branches of the HSE and healthcare organisations right around the world. The challenge for me as medical director is to change that culture, to try and build up a culture of trust between us and all of the staff around the country, that they know that if they make a mistake, that they can come forward, report it, they'll be dealt with sympathetically, and it won't impact on them within the job, and they won't be punished for it.